Chapter 15 looks at drugs for the treatment of central nervous system disorders. So central nervous system refers to the brain and spinal cord, and we're going to look at disorders that happens in the brain and then the drugs we can use to treat those brain disorders. There are many psychiatric disorders we'll look at. Some of them are depression, schizophrenia, anxiety, panic, OCD. Those are some of the disorders we'll look at. And then there are some drugs that we can use to treat those disorders. So antipsychotic drugs, antidepressant drugs, and even drugs to treat bipolar depression. We'll look at what bipolar depression also means in this lecture. So when we look at psychiatric disorders, there's basically three main headings. The first one is psychosis, which is this one over here. And when you think of psychosis, just think of schizophrenia. Schizophrenia falls under the psychosis category. Then there's affective disorder, and affective disorder looks at depression. There's unipolar, which is just the regular depression when the person is depressed. And then there's bipolar depression, and bipolar is basically when the person has it feels extremely happy and then feels extremely sad. So it's bipolar, two ends of the spectrum. Extremely happy and then extremely sad. We also look at neurosis, which basically is anxiety. When someone has anxiety disorder, it could be panic disorder, it could be OCD as well. So there are drugs to treat all these psychiatric disorders. So one of the psychiatric disorder is schizophrenia. And schizophrenia is really interesting because if someone has schizophrenia, they can show, it's actually the most common type of psychosis, and it's basically an extensive disturbance of personality function. So that means that this person who has schizophrenia has a loss of perception of reality. They experience delusions, they experience paranoia, they sometimes it's like the other people are telling them that everyone's out to get them, everyone's out to kill them, or other people, they think that other people are telling them to go and commit serious crimes. So symptoms of schizophrenia includes delusions, hallucinations. They have all these symptoms. Their speech may be disorganized. So that's one type of symptoms. So positive symptoms are delusions, hallucinations, aggressiveness. Extrapyramidal symptoms is also something that is very common with schizophrenia. And what this means is actually we'll look at it at the next slide, but it's actually when people have a lot more, when people have involuntary movements. So they're moving a lot more than they normally should. It could be tremors. It could be, if I show you the next slide, it'll make more sense. Muscle spasms, right? They just have protrusion and rolling of the tongue. They're restless. So there's many different symptoms that we'll look at when we get to the next slide. So positive symptoms are these symptoms that are pretty aggressive. Negative symptoms are these symptoms, which are flat effect. And when I say flat effect, what that means is they can't show emotion. So yes, they feel emotion, but they cannot express their emotion. And apathy is like they have lack of interest, lack of enthusiasm. They're not talking, reduced speech. So it could be positive symptoms or negative symptoms that someone could experience. So the extrapyramidal symptoms that we were looking at could be any of these four. It could be pseudoparkinsonism, and that is basically when they have loss of tremors. So this is someone who has schizophrenia. This is a possible symptom that they could have. They could show acute dystonia, and acute dystonia looks at this, where someone would have muscle spasms of the tongue, the face, or even the neck. This is another one, akathisia, and this is where they're restless. They have trouble standing still. They pace, the floor constantly. And this is a very common one. This could be a test question. That's why I have boxed it. This is called tardive dyskinesia, and this is when someone has protrusion of the tongue or rolling of the tongue. They have sucking and smacking movements of the lip. They have involuntary movements of the body and extremities. So this is actually a very common thing. So if I ask you in the test, what are some side effects of some medications, and if the side effects say extrapyramidal symptoms, one of the most common one is tardive dyskinesia. And when I get to that slide, I'll be sure to highlight it again. So we looked at schizophrenia, which is one type of psychiatric disorder. Another type of psychiatric disorder that falls under the affective disorder or that category is depression. And so depression, there's three forms. There's the endogenous depression, exogenous depression, and bipolar depression. Endogenous depression is basically when someone is depressed or when someone is sad, and it could be due to a genetic reason. Maybe their parents had depression and that's why they have depression. Exogenous depression, this is because of a specific event. Maybe they just recently lost their baby. Maybe they had a death in their family. Maybe they had a traumatic, maybe they were raped. Maybe there could be so many bad events that could have happened to them that caused them to fall under depression. So endogenous depression is, there's no event that caused this depression, but exogenous depression is basically when there was an event that happened in their life that caused the depression. So exo means something outside, an outside event that happened that caused it. So a death in the family, for example. Bipolar depression is also known as maniac depressive disorder. So this is when someone, and I have a picture of it later on, when someone is extremely happy and then extremely sad. So they have two ends of the spectrum. But typically people who are depressed have these type of symptoms. So they have low mood, they may not want to eat, their sleep is disturbed, right? They feel very tired, they can't concentrate. These are all symptoms of depression. The last category we're going to look at is neurosis, and this is where someone could have anxiety issues or panic disorder, phobia, so they could be extremely fearful of something. OCD is very common. So all these fall under the neurosis category. One thing that's really important is that when we're treating patients with mental disorders, we need to be mindful of how we communicate to them. In the textbook, it says that the author once asked a client, "How are you?" And the client took it the bad way or the wrong way. So when you communicate to them, they may find it very threatening. They may find it as if you're out to get them. So be mindful of that. Don't let it get to you if they respond in a bad way. Compliance, so clients may not want to take their medication. Clients may not want to brush or floss their teeth, right? So their compliance will probably be poor, and they could also be suicidal. So when we look at drugs, there are first-generation drugs and second-generation antipsychotic drugs. And so in the next video, we'll look at what the difference is between the two.